Hello, everybody. Thank you, Mr. Brulakis, for the honorary invitation in this physiotherapy course. And I will start my presentation. As we hear from from my colleague, the medical history of the case, I'm not going to analyze it. Probably after 2 weeks, after surgery, he's going to come for a rehabilitation program. It's the left shoulder. And something like that, when I see the medical report, something like that is coming on my mind about acromioplasty, repair, and biceps tenotomy. And when I was starting doing the presentation, I based my presentation on a 4-phase model protocol of rehabilitation. And then I was starting writing all the details from day one. And I was going to ask the doctor if we use immobilizing and etc. And there, in the second phase, which is from 6 to 12 weeks, we have many details about the rehabilitation program. We have to protect the surgery and tissue healing and like that. And there are many other things that we can do in phase 3 and 4. But then we had a Skype meeting and everything changed. And I had to start my presentation from the beginning because I hear that you don't just need the protocol, you need the philosophy. So we saw the physiotherapy protocol, and my presentation could end here by analyzing all the details of the protocol, but there is a possibility that the doctor will call me in a few weeks and he will tell me what you did there. Okay, so that will be very stressful. I want to avoid that. So then I pick up the phone, I call the doctor to have more information, what you need to know in order to start the rehabilitation. What other structure, what it comes in your mind when you first see the patient, and what more things you would like to know. So I asked Mr. Brulakis that he has done the surgery, and now we are on the phone. Okay, I can ask more things now. I keep on my mind that tears and lesions of the rotator cuff are a frequent cause of shoulder pain and disability. Surgical repair of the rotator cuff is a value procedure to improve shoulder function and decrease pain in this patient. However, there is no consensus concerning the rehabilitation protocol following surgery. Oh, it makes the things more difficult and more complicated. And what I have on my mind when I see a client, there are more things than except the surgery. I would like to ask a few more things about medical history, genetic, metabolic disorders, because we don't just see a shoulder and a surgery. There are many other things that usually in our daily practice we see that patient is coming with hormonological problems that we will see later, what and how can affect tendon metabolism, tendon rehabilitation, and tendon repair. And even hypercholesterolemia could affect tendon biomechanical properties, even obesity and BMI. Diabetes mellitus has detrimental effects on both tendon homeostasis and as well as tendon healing, which is very important for me to know more about inflammatory condition and like that. And I will ask again, how is the condition of the tissue, and what did you see in the surgery? Because we have 2.5 years ago, we had a traumatic injury on his left shoulder, and we know that usually we have fatty infiltration, which is very important for my therapeutic exercise protocol and also mobilization. How was the structure, the microstructure of the tendon, and the pathology, the neuroanatomy also, because we have a chronic condition with central sensitization and peripheral sensitization, and the microstructure where just the surgeon know how it was because he saw during the arthroscopy. There are many factors that can influence. We can see here factors affecting healing after arthroscopic rotator cuff repair, even the size of the tear, the quality of the muscle, the greater muscle tendon retraction, smoking, diabetes, hypercholesterolemia, even some medication. If we see a patient and his face is like that, and with the bag of medication, then we have to think more, because there are drugs with reported risk of tendinopathy, even rupture, that can have a lot of effects in our rehabilitation. A Greek man, 60 years old, it's very possible to take statins. If in those 2.5 years he had some glucocorticoid injections, which is probably, we care about his age, but especially for his biological age, not only the chronological. And it's important that we can see here that in our mind are coming 45 and more risk factors in 4 aspects, sociodemographic, preoperative, that those risk factors can affecting rotator cuff re-tear or rehabilitation after arthroscopic repair. And one of those factors, it is how long, and I will ask Mr. Brilakis, how long was the surgery? It was 30, 45 minutes, or it was 3.5 hours. Then it's an important information, the tear of the length of fat infiltration, the duration of the symptoms, which it was 2.5 years old, the bone mineral density, and more other things. And during, when we are going to start rehabilitation, how he will fight with that, and we have to support him, because if he stay at Easter time in the house that he had the surgery, and he start drinking every day a bottle of wine, and he start doing a packet of cigarettes, it could have some effects on rehabilitation, because we know that unhealthy lifestyle factors, there is a strong association between lifestyle factors and tendon healing after surgery. Feet, fork, fingers, sleep, stress, and love. We can explain all that concept. Even what he eat is very important, as we saw that hypercholesterolemia is important, and diabetes, and we have to be holistic, not just specific to the shoulder. And then before I will ask again, before I hang up the phone, is there anything else I need to look out for? Can I follow the protocol? Should I proceed with the recovery smoothly without rushing? And then if I want to start some therapeutic exercise, I will start with core stability, which is very important, and from the early stage, because we know there is a strong relationship between shoulder dysfunction and core stability dysfunction. And if we want to apply the manipulation according to the Ackerman method, we have to be holistic. Okay, we know that there are a lot of research that says about the relationship between spinal manipulation and shoulder range of motion, and pain, in individuals with shoulder pain. And in our manipulation approach, we have to be holistic: pelvis, lumbar, thoracic, and spine. And during the first week, especially, that he has to use the eyes, he has to try more in the first two weeks, especially. We can support him with some short videos. Even I used to give them a short video that I present some exercises, because we know that relaxation exercises decreases pain after arthroscopic rotator cuff repair, and relaxation exercises allow patients to use lower opioid analgesic doses. So there's some small details that are important, especially for the first 2 weeks, because he has to fight with the inflammation and the pain. So it's important that we have this kind of research. And if it's Easter, he can use more prayer, because we know that with meditation he can fight better pain, and just 5 minutes is enough. And we have then the 4-phase protocol, which is lasts The first phase, 6 weeks, starting on the first day after the operation. During this time, the key target include achieving good tendon healing without post-operative adhesions. I watch also the time. So the first 6 weeks, we have to protect the surgery. We have to ask the doctor. In some cases, he will use immobilizing. In some cases, he could not use it. We have to know that to decrease pain and inflammation, increase range of motion, immobilization, pendulum exercise, active movement to elbow, waist and fingers, posture and control of scapula, walking every day, at least for 30 minutes, isometric exercise, joint stability, learning the optimal positioning of the scapula and centering of the humeral head, which is very important. And then we can go from 6 to 12 weeks, which is the target is full passive range of motion without pain, decrease pain, improving the function of muscle strength from active assisted range of motion to active range of motion, and isometric strengthening until the 4 to 6 month that we have full and pain-free active range of motion, improving strength and flexibility. And that was the success of the treatment. Congratulations. Thank you.